Welcome to Tell Me Your Story. New paradigms for a new world where we're giving you choices and knowledge of those choices to help make your dreams come true. We are here 9 times a week. Sundays at 7 a.m. and 7 p.m., Monday mornings at 1 a.m., Wednesdays at 9 a.m., and Monday through Friday from 8 to 9 a.m., streaming live at all those times at richarddugan.com. We are on SoundCloud, iTunes, TuneIn Radio, Spotify, Stitcher, Player FM, as well as YouTube, where you can watch these conversations. I hope that you will take time to subscribe and click notifications so that when a new conversation is posted, you'll be notified and you'll be able to tune in, listen in, and learn, be entertained and inspired. A reminder that Choices, which is my book, 5 Steps for Life, it's available on Amazon.com in paperback, hardcover, and Kindle with Audible, soon to be released. We also ask that if you can support the work that we are doing financially, we do have a PayPal account. It is there for your security as well as ours. And when they ask for an email address to whom you're sending, please go to richard@richarddugan.com. That's the email address. If you go to richarddugan.com, there is also a link directly to PayPal so that you can send us whatever support you can. And we thank you to those who have helped and to those who will help. We also ask that you take time during this decade of perfect vision, the 2020s, to go within to that quiet, peaceful, calm, still place and listen to that still, small voice. And with that, we now take you to our very special interview and guest here on Tell Me Your Story. And welcome to Tell Me Your Story. I am Reverend Dr. D. Richard Dugan, and my very special guest is joining us to talk about an area that, and I've said this over the years, this is a topic I should not be here interviewing because I know nothing. Well, I know a little, I guess. We're going to talk with Janette Gray about women's sexual health issues that they should not be dismissed when they're treatable medical conditions. And Janette, thank you so much for joining us here on the program today.
Yes, absolutely. I'm honored to be here.
Well, you know, one of the things that is so interesting is that millions of women experiencing hormonal transitions face profound changes to their sexual well-being. Why is it that important? And being a guy, obviously when I was a kid, growing up, I'm 65, growing up in the 20s, my 20s, 30s, 40s, even into my 50s.
Right.
Yeah, I was kind of sort of in a way a big deal. But I'm 65 and it's, I'll take it or leave it kind of thing. So explain to us why this issue is so important these days.
Well, I think they probably have always been important, but now that we question a little bit more, there's social media, there's a different level of discussion, and women have gained some level of status in society in general. And so now the topic is coming up more. And you're right that women go through menopause and perimenopause, and these are transitions in a woman's life where hormones start going down. You get deficiencies of estrogen, progesterone, testosterone, resulting in changes in sexual health. And why is sexual health important? Well, not only does it provide happiness, which, is enjoyment, satisfaction, meaning, but it also helps keep a relationship together. It's intimacy. It's a feeling of, a woman would feel safe, if she's connected to her partner. If you go back to evolution, having sex with your partner, obviously you're going to propagate the species. And then if it's a pleasurable experience, you're going to want to do it more. Mm-hmm. So, a lot of reasons, but in modern society, I think it's just part of being, a sexual being. It completes you, and how you define that can depend on what society you live in and what, home you grow up in and what your beliefs are. But it still is sexual health being important for women.
Now you have a website, and if I do have it correct, it is perfectbalance.health.
Yes,
And
correct.
we want people to go there to check out the work that she is doing and what we're going to be talking about in this program. As I said, I am 65, and there are a lot of different reasons why men disconnect, if you will, sexually. And it also could be hormonal, if I'm not mistaken. Of course, we're here talking about women.
Yes, right.
Uh, so,
Absolutely.
it has come to my attention from some research years ago that I did that the majority of the statistics, medical statistics that they had for, I'm going to use the term generically, human beings, those
Mhm.
statistics were taken from men. Those were
Yes.
all male statistics. When did we begin to realize that, oh, wait a minute, maybe this isn't so accurate? Maybe we should start testing the women. When did that
It,
start?
yeah, it's a moving target, but certainly, I mean, I can give you an example. Just last year, the NIH budget to study women's health was about 10%, and for menopause, it was 0.03%. So today, and we're still having a scarcity of studies using women as the cohorts. But again, there's been a lot that has happened in the last year. In fact, just last week, the FDA approved a drug called Addie for hypoactive sexual desire disorder in menopausal women less than 65 years of age. And that is, I mean, compared to Viagra, that's been around for over 25 years, and the fact that FDA approved testosterone prescriptions for men, there are probably 30 of them and none for women. So it's just, all the studies, as you mentioned, mostly have men, and they're realizing that men and women are not the same. And we have different risk factors and different results when you look at the studies.
That's shocking. I never would have
Mhm.
guessed that. That we were
Right?
different. Uh,
Right.
y-
God, how is that possible? Right?
How is it even? Yeah, exactly. We're all on the same planet. We should all have the same biology, and that's not the way it works. I wish I could
No.
remember his name, but the author of the book "Men Are from Mars, Women Are from Venus," he was pretty
Oh,
clear
right.
on
Yeah.
the fact that there are differences, and they are neither good nor bad. They just are
No,
differences.
exactly.
Is there? I bet you this has probably changed over the decades, but is there a point, a demarcation, if you will, or milestone point in terms of age when a lot of these things start happening to women? Is it now? I used to be menopause was, I think it was like in the 50s, age
Right.
50 to
Uh-huh.
60. I'm wondering if
Yes.
it's now happening earlier or if it's still in that range, or how has that changed?
Right. Well, there's a lot of confusion just about the terminology.
Hmm.
Menopause technically is the first day after 1 year of not having a natural menstruation for a woman. And then you're postmenopausal after that day. But then there's perimenopause, which is this period of time that can be up to 10 years or even longer, where a woman's hormones are fluctuating, going up and down. And it's during that time that many women get misdiagnosed with disorders such as depression and anxiety. In fact, there was a study that showed that women were, I think, 4 times more, no, 4 times more likely to be prescribed an antidepressant than hormones when they go in with symptoms of anxiety or low mood or not sleeping. So it's very interesting how, it's how women just have not gotten the attention, and the diagnosis is missed so often, and it can start in your mid 30s.
Wow.
So 1/3 to a half of a woman's life could be spent in this transition, hormonal transition.
Well, this is quite a challenge for us in our society these days because so many people are distrustful of the institutions and the information
Yes,
that they dispense.
of course.
That's got to be a concern as well. I'll throw one case point out there: hormonal therapy. My wife, she went
Mhm.
through in 2001 a diagnosis of a rare form of fallopian tube cancer. They
Mhm.
went in on the 10th of August of that year and
Mhm.
removed, had a full hysterectomy plus some lymph nodes, and they
Wow.
got it all, and she's been fine ever since.
Mhm.
And then they suggested hormone therapy. But at that time, a lot of the concerns were about the fact that hormonal therapy could actually reactivate the cancer cells if there were any, or generate new ones and that kind of thing. Is that still the case? Because obviously that's part of what you're promoting here. So, what about the risks in terms of, we'll call them the side effects?
Right. Yeah. Well, I've been treating men and women with hormone deficiencies with hormones for over 25 years, and I've seen a lot, needless to say, and there's still a lot of research that's necessary, back to the point of, women not being studied, and specifically menopausal and perimenopausal women. And so we still don't have an answer for the fact if somebody is actively having, has cancer, especially breast cancer or uterine or ovarian, how that correlates with the use or the prescribing of estrogen. Because a woman before menopause has very high levels of estrogen as she cycles through a menstrual cycle. And that doesn't seem to cause breast cancer per se or other cancers, but we just don't know. One thing we do know is vaginal estrogen, which is a wonderful treatment for what they call genitourinary syndrome of menopause, which can be urinary tract infections, incontinence, vaginal dryness, pain with intercourse, and you can prescribe that with to a woman who has active breast cancer safely.
Hmm.
But studies have not really been done, and I don't know if they will be done, where you can actually prove that estrogen does or doesn't activate a cancer.
You know, when setting up this interview, there was a concern that, you may have a G audience, but the language. I said, well, as long as we stick to the proper terminology, we'll be fine.
Exactly.
And that
Right.
also seems to be part of the problem, that we have people, I don't want to say they're prudish,
Yeah.
but they have a misunderstanding of the language. When you
Yes.
use penis and vagina and vulva and on, and the list goes on,
Right.
uh, those are perfectly acceptable terms that hopefully most people know what they are.
Right.
Do you run into that in your practice? And by the way, folks, she is an MD.
Yes, absolutely. I think that it really goes way back to, um, are we properly educating? Is sex education adequate? Is an hour or a little course when we're in ninth grade enough to help you go into the future and understand your body? So if we can't name the parts, how can we understand our bodies? And men and women are not getting educated about what sex can be. I mean, I think it's fascinating that women have like 8,000 nerves endings in the clitoris, and only about 10% of women can have an orgasm vaginally. But how do you learn those things? It's really, it's not out there. The education isn't there. So and part of it is cultural, societal norms, things like that. But we need to normalize the language. Start with
Well,
that.
yeah. Well, there's also this aspect of what is normal,
Right.
and there's a part of me that thinks we need to do away with that word
Yes, I
because,
agree. When I said it, I felt that when I said it
yeah.
immediately.
But what's
Hmm.
funny is that, I mean, for example, I'm dealing with the issues with high blood sugar, trying to
Yeah.
get that under control. And I have done some research that says that stress can
Yes.
actually raise your sugar
Oh,
levels.
yeah. Cortisol.
And if you can't get your stress level down,
Yeah.
then your sugar levels aren't going to go down. And mine were fine. I was diagnosed in 2020 and I got my blood sugar down in 6 weeks. 6 weeks, I got it down to normal and
Uh-huh.
without medication. Now, I was
Yes.
on medication. I
Right.
cut it in half. And then I went to the doctor in February of the following year, and he says, "Oh, go ahead and knock off one pill." Well,
Yeah.
I figured I'm checking my readings,
Right.
still normal. So I got rid of the second pill. I'm not taking
Yeah.
any, and
Yeah.
it stayed
Wonderful.
normal until 2024 April,
Yeah,
and
well,
that was when a lot of stuff. Yeah.
insulin resistance, which is before you get to diabetes, is multifactorial for sure.
Hmm.
There's a genetic factor. How well does your pancreas work? The islet cells of the pancreas. Are you exercising? Are you overweight? Are you stressed? Are you sleeping enough? There's a lot of things that can affect your blood sugar levels.
Yeah. And yet when I shared that information with my physician, he didn't believe it. It was like, "Oh, no, that's not true." And so that's where, and we're going to get back to women,
Yes.
having to do with trusting what their body is telling them. Not only in terms of we'll refer to it as disease, because what a lot of stuff we're talking about is not a disease, but it
Right.
is disease.
Dis-ease, exactly.
But the body, through these processes, is telling them something about what's going on, right?
Well, our medical model is a disease model, and the disease model waits for something to be broken, and then it says, okay, here's the fix, a medication or a surgical intervention. And because of that, and in addition, a broken, insurance-based medical system where a doctor or medical provider may get 5 minutes, 10 minutes with a patient, there isn't time for a patient to, express how they're feeling or what their intuition is telling them about their body. It's a quick, what condition, disease do you have? Here's a pill, goodbye.
Hmm. Yeah. And that is a frustration for all of us, men and women, is that we're
Yeah.
given a prescription for the symptoms. As a matter of fact,
So
I
how
was
can you
watching something.
establish trust,
Yeah,
if you don't have time to develop a relationship and
yeah.
share things? Yeah.
I've even heard that in my case with the blood sugar, metformin is only treating the symptom. But I also heard just recently, so is insulin.
Yeah.
May be getting your sugar back to normal, but all it's still treating is the symptom. You haven't solved the problem. So back to the hormonal therapy and the issues
Mhm.
concerning women
Yeah.
do we want to say senior years?
Well,
It's
I
not
see
just
it
there.
more, no, I see it more as a woman going through different phases of her life, and after going into menopause is just, it's really a newfound freedom. No period, no fear of getting pregnant. I mean, you know, it's a great time. It's got to be looked at with a different perspective, I think.
Hmm. Well, this is it's fascinating to me, obviously, because I have in my family on my mother's side, I've got my mother, I have my three remaining sisters, and of course,
Hmm.
obviously, my wife. I don't,
Right.
she's
Surrounded by women.
surrounded by women. I mean, my brother and my father and I were surrounded by five women. I had a fourth sister, an elder sister, and so
Right.
we had major estrogen flowing in the house, minor
Yes.
testosterone. But
Uh,
there's an interesting fact, and I want to just go over to this one just a little bit as far as this whole transgender stuff.
uh,
If we were to take a look, and I learned this in biology in high school, and
yeah.
this is what fascinates me about everybody's going bananas over this whole trans stuff.
Mhm.
We all, every single human being that has ever existed or will ever exist, started out as a female. Is my research, my information from biology right or wrong?
That is correct. That's embryologically, it starts as a female, and then as different genes are expressed on the Y chromosome, you then develop, the male characteristics. And in fact, the penis and the clitoris and the vaginal and the vulva of the female are really very parallel.
Really? Wow.
Yes, anatomy. Like the hood of the clitoris is the head of the penis, and I don't know, I don't remember my anatomy that well because I'm not a urologist, but when it's described, all the different, you can say this correlates with that, that correlates with that.
Mm-hmm. Well, it's so fascinating to me because when you take a look at that specific biological process,
Mhm.
there was no choice involved when it came to no, we'll add another X. No, we'll
Yeah,
put a Y in this time. No, X
right.
this Y
Well,
that
there are
it was
those genetic abnormalities, but they're rare.
granted, but it wasn't. It had nothing to do with the choice. It was biology.
No,
So I have to
exactly.
wonder. My thinking, and again, this is still on that other subject, that people who are in that mindset, that feeling, if you will, maybe a belief, that they're in the wrong body and they want to
Yeah.
make a transition to the right body.
Mhm.
I wonder if it's more due to social um, constraints, if you will, or input. I mean, I was bullied as a kid in school, but I didn't change, not in that context. And I have to wonder sometimes if maybe subconsciously it is a choice. And again, I'm not passing judgment. If you're
Yeah.
not
Oh no.
comfortable in your body,
Well, I
leave.
don't I don't treat,
No, I know.
gender, because that you're getting into really, higher dosages of the hormones. And again, I, like you, I have no judgment or, feelings, against it at all. I just think, and I think that when you talk to transgender individuals, they describe it, some of them, as a feeling that, like you say, that they're in the wrong body. And how much of that is environmental is a good question.
Hmm. Very strange. It's one of those things that we pass judgment on and we know very little about it. And yet
Yes,
we still pass judgment. And that's
I
kind of
know,
like
right?
when an accident happens, you
Yeah,
know, and an individual is, something happens and you get 10 people who have 10 different perspectives, you know,
right.
but at the same time, you don't really know how it happened, what caused it, you
Now,
know.
what is the truth?
Yeah. Did they suddenly get blurry vision? Did they have a seizure? Was there a mechanical issue? But we
Right,
immediately knee jerk to saying, "Oh," and we say, "Oh, that's terrible. That's awful." It's like, well,
right.
you just don't know what happened. So it's like I said, it's really kind of unfortunate that we.
I wanted to get back to when
Yes.
you said about, you know, when you approach a patient, how it's very important to have a holistic approach. And my practice was integrative medicine, where we had Western medicine combined with acupuncture, chiropractic, naturopathic. And I think it's really important to look at the whole person and not, like you said, not just treat with insulin, but are they exercising? Is their weight good? Are they sleeping? Are they stressed? That's a holistic approach to care. And that, I think, is missing in our medical model to a large extent.
Yeah. Well, we're talking today here with Janette Gray, and we are talking about women's health, women's sexual health and well-being. And we're going to continue doing so as we continue here on Tell Me Your Story. I am Reverend Dr. D. Richard Dugan. She is Dr. Janette Gray, and no connection to Gray's Anatomy, right?
No, not that I know of.
Not that you know of. How long have you been? How long have you been in practice, and especially focusing on women's health?
I actually have been treating men and women with hormone deficiencies for over 25 years. But as a woman physician, I would say that probably 70% of my patients are women. So I have gotten better and better at women's health because of that.
Hmm. And is it because it was interesting to you, or because you're a woman and you'll find answers to some of your questions?
Truthfully, I've always had a very holistic approach to people's care, and I really like to get to the root cause of people's dis-ease or diseases. And band-aids, I don't think, are the right answer in this situation. And a lot of times, an antidepressant, for instance, is a band-aid, and maybe she's just going through perimenopause and her estrogen levels are fluctuating. So why not treat the cause versus using a band-aid? So, and women, are a little bit more complicated. And so I did have a challenge to try to figure out how to help women and get to the root cause.
Well, I'll tell you, it's half the population.
Exactly.
And it seems as though finally, correct me if I'm wrong, but finally, we're starting to take it seriously that we need to take a look at both sides,
Right.
not just the male, but the female as well. And
key, it's we work together in synergy, and it should be a beautiful thing and not excluding or and so I think it's with the internet and social media, it really is consumer driven. The people are saying we want, we need, we deserve.
that's one of the interesting things when you start talking about the whole health care issue.
Mm-hmm.
And it's like, how can an individual deny someone else? I mean, I'll use myself and my wife as a case in point that
Mm-hmm.
she is going through some serious stuff, and I sometimes drop everything. I've taken her since we moved here to the mountain called Twin Peaks, where we live near Lake Arrowhead. Sadly, I've taken her to the since 12th of October. I've taken her to the emergency room 3 times.
Yeah, that's unfortunate, and because the emergency room is not where people address the holistic aspect of disease. It's very much acute. What are you dying? And if you're not dying, you can go home, which is unfortunate. But perimenopause and menopause can be confusing because there's probably over 300 symptoms and signs of perimenopause and menopause, and it can be misdiagnosed, and you can be diagnosed with all sorts of other conditions, and it's very important to rule out and rule in different conditions.
Well, I'll tell you, it's sometimes difficult. It's sometimes quite a challenge because
Yes.
I have all kinds of questions. This is where the guy gets himself in trouble. I have all kinds of questions when she's going through the discomfort that she goes through,
Yes.
so that I can understand. Because when we do get to the ER, I need to explain to them, because she's not going to be in any condition
Right.
other than maybe to nod her head saying, "Yeah, he's correct, he's correct."
Yeah.
And yet at the same time, she's in no position to answer questions.
Right. No, in my book, The Truth About Sex Hormones, I really emphasize how important self-advocacy is, or if you have your partner or loved one or somebody that can advocate for you, it's so important.
We are talking with Janette Gray, Dr. Janette Gray, internal medicine physician, hormone expert, author of The Truth, as she just stated, The Truth About Hormones, and medical director and founder of the PerfectBalance Health, PerfectBalance Health. That's what it says right there. And it addresses the hormonal changes affecting intimacy and why pain, loss of desire, and physical changes are treatable. That's right. They are treatable conditions. And we're going to continue our conversation here on Tell Me Your Story. I am Reverend Dr. D. She is Dr. Janette Gray. She's a certified doctor. She has the credentials. I don't. So don't come to me with your problems. Not those kind of problems anyway. We'll talk through some of your stuff if you'd like, but the bottom line is that that seems to also be an issue too, is the conversation or lack thereof, sometimes with the partner, but
Right.
especially with the doctor. Is
Yes.
it better for a woman to go to a female doctor, or really does it make that much difference?
I think first of all, it's most important that that medical provider, whether it's a doctor or a PA or nurse practitioner, be educated in women's health and menopause and perimenopause and sexual health in particular. Then you might say, okay, once they've gotten over that hurdle, do I prefer a woman or a male medical provider? And I would say probably a woman is going to be able to relate a little bit better to a woman patient, but I've seen men that are, great, physicians or medical providers and can connect with women patients very well. So, I think it's a personal choice, really.
I know that, and this is probably more tongue in cheek, stated that men would prefer a female doctor because, well, it's a female and we're attracted to females, right? But I'm sure there are times when, no, I got to talk to a guy. It's
Yeah,
just,
no, there's definitely that. And with men, a lot of times, they don't even like to go into the doctor's office. The wife or the partners, you're just kind of pushing them to go in. So it's a little different setup with guys.
yeah, I'm not a fan myself. I do have white coat syndrome.
Yeah,
And every time I go in and they take my blood pressure, it's always a
right.
little elevated. And he said, well, we need to get that down. I say, well, when I take it when I'm at home, it's fine. It's only when I come here.
Right.
And again, psychologically or intellectually, there's nothing to be afraid of from that standpoint. And yet, there's something
Yeah.
inside that says,
Yeah.
I'm here, but I really don't want to be.
Well, who knows what's being triggered? It could be visual, it could be a smell, it could be a sound. Something is provoking that fight or flight response is what's going on.
Yeah, it is, there's no question. It is oh my goodness, it's a mixed bag in that regard. And then there's some people who can go in there and not a thought, and they go in there and have stuff done. I
Well, what if they find something, right? I mean, isn't that kind of one of the deep fears,
Yeah. Oh yeah.
right?
And it's funny too because I was sitting in a very an overstuffed chair with a blood pressure monitor,
Hmm.
and it was checking regularly, and they would not let me leave until I think it got down, I think to 159 over, because I had just had my decade colonoscopy.
Oh,
You know,
lucky you.
and it didn't bother me. I mean, I stayed awake. I didn't. No, fine.
Really?
Do what you got to do. I'm gonna. Plus the fact that I wanted to be able to drive myself home,
Right.
and so, but I had it
Wow.
done without being put under the first time.
I'm impressed because I want to be knocked out when they're doing that. I don't want to even know it got done, hardly.
Well, I'm still waiting for the video that I can download and post
Yeah.
on YouTube. Hey,
Yeah.
gang, watch
Fun.
this. No, I would
Yeah. No,
never.
it's like going in a spaceship.
It kind of is. Oh, I remember that the movie where they shrunk the people down, and I think it was that they
Oh,
dropped them
right.
off in the eye duct, and they went inside to try to solve a problem medically that they couldn't
Hmm.
do because it was so microscopic.
Yeah.
I wish I could remember the name of the movie, but
Yeah. I
it's
know which one you mean. I don't remember either.
yeah. What is it? Has women's health? And again, I don't know how far back we can go because I don't know how far back we have statistics. But has women's
Mhm.
health gotten worse? I mean, are there conditions that are here today that we had 50 or 100 years ago, but we called it something else? Or is this something new that we didn't have 50 or 100 years ago?
Yeah. No, that's a very good question. I mean, like we talked about, as the women's health comes more into view, and women can speak up and speak out, then they can describe feelings and issues that they're having. But let's take genitourinary syndrome of menopause, which I was saying before, is due to decrease in estrogen and progesterone, testosterone, but primarily estrogen. And you get vaginal dryness, thinning of the vaginal wall. You can get recurrent UTIs, pain with intercourse, decreased arousal. Now, if you don't know the name of your anatomy, if you are in a society or culture or family where it's taboo, or there's some kind of shame around your sexuality, or you don't even know to mention it because you think it's just normal aging. There's all those reasons why something even today doesn't get brought up with your provider, medical provider, or your partner.
Well, that's interesting because, and this is now going back 44 years when I was 21.
Yeah.
I came home in the morning after, I'll just use the term, my dalliance, my first. To which my mother says, okay, I know where you've been, but what are you going to tell the kids? Because they've been asking. To which I said, I'll tell them the truth. That I spent the night with so-and-so and, that kind of thing. I may not go into detail per se, but at least I'd let them know.
Right. There's nothing to be ashamed about.
Yeah, I didn't, that was me. That I didn't have any problem with it. But I know that a lot of people have trouble just talking about these kinds.
But I think men are more apt to talk about sex and their experiences than women, historically.
Mm-hmm. Yeah, it's really unfortunate because when we don't have those conversations, somewhere down the road, all of a sudden, oh, I got this pain and I got to go to the doctor. And it turns out that if they'd gone in when they felt the pain, it might have been something that was benign. And now
and that goes back to not treating conditions, at the root cause, whether it's a man that's having, erectile dysfunction or his own lack of desire, or a woman's lack of desire and arousal. And you don't realize that it's a problem, and you blame yourself. You go, something's wrong with me. It's my fault. And that affects the relationship, which can affect the family unit, which, so it ripples continue to go out.
Yeah. And then it affects the rest of the family or those that are, associated, and has what can be a detrimental effect, and then start causing problems with others because of the stress primarily. We talked earlier again about stress affecting your sugar levels. Well, stress affects all kinds of things, but when you don't deal with the stressors, then they get worse, right?
But if you blame yourself or you don't recognize the symptoms and signs as a true problem, you don't even know to bring it up to solve the problem, because you don't even know what the problem is.
Exactly right. You don't even know what the problem is. Well, folks, this is a conversation that we hope that you will have. It's important, okay? We hope that you'll get yourself a copy of her book and go to her website. And I am really, really encouraging you to go to perfectbalance.health, perfectbalance.health, and know that the situation is not untenable. I will say also, the truth about the hormones, by the way, is the book title. We hope
about sex hormones.
Sex hormones. I beg your pardon. It says the truth.
Get the sex in there.
Sex hormones. The truth about sex hormones. There you go. But The ones that I'm familiar with, of course, are obviously testosterone, estrogen, but there's also a third. There's a progesterone,
Right.
and
That's
then
another key. There's DHEA and other hormones that are like insulin and thyroid, but the sex hormones are primarily estrogen, progesterone, and testosterone, with testosterone being the dominant hormone in men and estrogen being the dominant hormone in women.
mm. Well, we want you to get a copy of the book. And again, the website is called perfectbalance.health as we continue here on this health program. Tell me your story. I'm Richard Dugan. She is Dr. Gray, Dr. Janette Gray. Same as my sister, only she spells it with an A. That is, Dr. Gray spells it with an A. And it's
Right.
great to have you with us here. I know that I want to dive into a different, same subject, a little different area.
Hmm.
And you alluded to it early in the program in terms of all of the different aspects that this affects. And I want to talk a little bit more about the spiritual impact on a woman,
Mm,
especially.
yes.
Um, I know that there are some women, it usually is that the sex drive drops off after a certain age, maybe in the 60s or possibly the 70s. But sometimes it goes the other way and it goes up. Is that right?
Because sexual desire is so multifactorial, bio, psycho, social. As we alluded to before, when you go into menopause as a woman, there is a sense of freedom, from getting pregnant. You're developing more wisdom. You're more comfortable with your body. So there are some women that say, you know what, sex has never been this good. But I would say the majority of women, they peak, their testosterone peaks at about 30 and it goes down as it does in men as well. And then in menopause, all the hormones are practically zero. So a lot of the normal arousal and desire and those things that those hormones create are not happening because you're not making those hormones anymore.
Now, that's what's interesting to me in terms of one's one's desire, one's another term, libido.
Mm-hmm.
As I have gotten older, like everybody else, our chemistry changes.
Mm-hmm.
So, is this a normal chemical change in the body as the body is getting older? Is that normal? Or is there something in our society? It could be environmental, it could be a number of different things that is causing this that we should be concerned.
Right. Well, that's a huge question and, where to tackle it from. But I would say that, yes, it's normal to have your hormone levels go down as you age. And we know that men, their testosterone peaks around 30. And there's probably an evolutionary reason, that as you get older, your hormones go down. And that way, the young stud is the one that's the sire, and you get the better genes, survival of the fittest, and all of that. But, we're not living in that kind of world so much anymore. And so, sex is not just about procreation, like we've talked about. It's about connection and intimacy. And like you said, the spiritual aspect, that you're connected to this world and this earth in some tangible way.
Hmm. Well, Dr. Janette Gray is an internal medicine physician and a recognized pioneer in integrative medicine and bioidentical hormones, if I have that right,
Yes,
replacement
perfect.
therapy. With
Uh-huh.
over 3 decades, 30 years of clinical experience, and also as founder and medical director of Perfect Balance Health in San Diego. Oh, San Diego, what a great place. I haven't been there in a long, long time, but
Yeah.
boy, when I was there, oh, it was so much fun.
I was born
Unfortunately,
and raised there.
wonderful. I was born and raised in the desert, and I don't know why,
Oh,
and I'm going to get answers to that.
oh
No,
my
it's
goodness.
It's fine. I got what I needed from the desert, and here we
Yeah.
go. So there it is, and but you've been doing this for 30 years. Before you went into this area, what were you? What was it? Just general practice?
Well, the way it works is, you finish medical school and then, 95% of people go into a residency, and residency can be family practice, internal medicine, OBGYN, and I chose internal medicine, which is adult medicine.
Mm,
And and as I started off my first job, I worked in a clinic where there was an acupuncturist that I became friends with, and I learned about other types of treatments and healthcare, and that patients really wanted more out of their healthcare than the traditional Western model. And
mm.
so basically after that, I opened up my own clinic and started getting providers like chiropractors and acupuncturists and naturopaths, and I created an integrative medical model. And then my personal specialty was hormone replacement therapy, primarily with bioidentical hormones.
What are bioidentical? Is it hormones that I'm thinking of
Yeah.
Sesame Street all of a
It's
sudden?
a funny term, but basically it's trying to differentiate synthetic hormones that are produced in the lab. And these hormones are made from like wild yam and soy, and the body recognizes them as self, not as foreign. So they're better tolerated and considered natural, if you want to, use that term.
Right. I know that the question always comes up when we're talking about all of these different ways of doing things that are
Mhm.
different than the way they'd been before, and the question always comes up for me is just because we can, does that mean we should? Because we
Right.
may not know the unintended consequences of
Yes.
doing that, whatever that happens to be.
Right. No, absolutely.
Do
Do
you
no
find
harm.
Yeah, do you find there's a concern in that regard? Because obviously you just started to mention the Hippocratic Oath there, as a physician, do no harm.
Right. Yeah. Well, this kind of brings up the topic of the a study 23 years ago, the Women's Health Initiative, that erroneously, and it was a poor study that looked at estrogen and progesterone in menopausal women, and at the time it was flagged for increase in breast cancer, strokes, and heart disease, and that's been debunked really just recently in the last year or so. And unfortunately, because of that, fewer studies have been done on women's health and hormones in particular. And it's taken that long for observational studies and some studies to show that it's safe and, in fact, doesn't cause breast cancer and heart disease. And, in fact, probably decreases, like a sector of that one study, the 50 to 59-year-old women on hormones, estrogen, progesterone, had a like 40% reduction in fatal MIs compared to placebo. So its impact is incredible. But to your point, you want to do no harm, and we don't have as many studies in all these areas that would be helpful to really say, okay, it's completely 100% safe. But on the other hand, you have to look at all the benefits we do know that you have with hormones. And so you have to balance, and I always tell patients, balance the known benefits like building bone and muscle and heart protection and prevention of Alzheimer's and cancers versus maybe an unknown. So at this point, we're doing our best to balance the benefits and the risks as we know them.
And what are the dangers to women's health in regards to the population of the medical community that I've heard, and maybe I heard wrong, is declining, that we have fewer doctors and nurses and other practitioners because they don't want to get into the business they're getting out. Is that, first of all, is my information even close to correct? Is there a concern regarding not having enough doctors to take care of the women and as well as men?
Well, one thing that is clear is that doctors are not going into private practice. The Marcus Welby and that traditional doctor role. You're seeing doctors going into institutions like the Kaisers and big medical groups, and so that is one aspect. And I do think that fewer doctors are going into primary care, which are really thought to be the boots on the ground that interface with patients at the beginning, when a symptom or sign first starts, or screening to prevent cancers and heart disease and things like that.
Yeah. Well, there's no question. I mean, my mother was a nurse for many years as we were growing up. Started out, I think, working. She was like one of those, like doctors making house calls. She worked for
Yeah.
a company where she would be sent to someone's home to take care of
Yeah.
whatever it was to take care of. And we're talking back in the 70s here, okay? Late
Right.
60s and 70s.
Yeah.
And then, on my first wife's side of the family, my mother-in-law, my late mother-in-law, she worked in the NICU, neonatal intensive care unit.
Neonatal. Yeah.
And she used to tell stories, not specifically of certain infants, but how, and we had this interesting conversation, how the nurses, including herself, when a baby was born, they just knew that they knew whether that child was or wasn't going to make it. And that sometimes did make it very difficult because they would still go out of their way to do everything they could
Yeah.
to keep that
course.
baby alive.
Right.
But they also knew too that it was almost a futile effort. I'm curious, using that as an example, if you think that the medical community has advanced at all in the last 20 or 30 years, and I've been talking about this in particular, where the medical community, at least years ago, did not know when to say when.
Yeah. When it's over, when the end is
Now,
there. Yeah. Well, that is another huge topic. And I did want to say, addressing nurses and your family members, that nurses really don't get the valued like I think they should be, because they have intuition. The ones that have been nursing for years have experience, and a lot of times they know things that the doctors don't know. And so I'm always, very respectful of nurse practitioners, because they really complement what we do. We're a team. So I wanted to say that one thing. And then the other, really, I don't even know where to begin.
well, I wanted to ask you about that in that regard. How often are you, using your intuition? Because most people say, no, base it. What about the test results, the hard and
Right.
fast information?
Right. Well, I always say that medicine is an art and a science. And what I love about it is that every individual, every medical provider can uniquely blend those and have their own flavor. And, it's for an individual as a consumer, the patient, it's finding a medical provider that resonates with you, that understands you, that gets you. And if you're the kind that wants to look at numbers, well, then, maybe you get somebody who's more numbers oriented, so it's really finding the match, just like a relationship, right?
Yeah, very true, very true. We're talking with Dr. Janette Gray, and we're talking about women's health and sexuality and sexual health, if you will. We will hope you go to her website and you find out more about the work that she is doing, especially if you are in need. Go to perfectbalance.health. That is the website. And we also encourage you to pick up a copy of her latest book, which is The Truth About Sex Hormones. Not just hormones, sex hormones, okay? It's
Right.
important. All of it
Yes.
is important. And do you do any consulting through Zoom and so forth of people through your website?
Yeah, oh, definitely. I mean, since COVID, telemedicine has become a way of life for patients and the medical providers. And I would say probably over half of my consultations are over, either a Zoom or some platform like that.
Well, folks, go to perfectbalance.health, get a copy of The Truth About Sex Hormones as we continue here on Tell Me Your Story. Dr. Janette Gray, I want to thank you so much for being a part of what we're trying to do to inform people, to educate them, but
Mm-hmm.
also because of the fact that you are there for the patient, male or female.
Mm-hmm.
At the same time, how do we inform the patient that it's really up to them? I mean, you know a lot. There's no question about it. But when
Mm-hmm.
in the final analysis,
Yeah,
it's up to the patient to make the decision. It's up to the patient to be informed and so forth.
right,
And it seems like
right.
we have over the decades abdicated to the doctor. Oh, well, the doctor knows best.
Yeah,
The doctor knows
right.
best.
Right.
Talk to
Yeah,
us.
no, you're relinquishing a lot of control when you do that. But that's where in my book, I really talk about the importance of educating yourself and self-advocacy. And I have a health and wellness wheel where I break down into more achievable segments, 8 sections of the wheel. And I talk about how exercise and nutrition and medical care and hormones all play an important role in your health. And you can chip away at each section at your own pace and as you educate yourself. So it's a process, but certainly it's a trust that has to be established with your medical provider, and that medical provider should be able to help educate you and give you the options and choices so you can make the most educated decision possible.
Well, we encourage people to get in touch with you through your website, perfectbalance.health. And that's really what we're looking for is balance. Dis-ease is out of balance. And of course, you get yourself back into balance. And I'm hoping to live another 35 years, but
Yeah.
not if I don't have quality of life.
Yeah,
Quality of
and
life.
that's the thing. It's health span and lifespan that
Exactly.
we are looking at. Better, longer life.
Yeah, because I'm looking for some great changes in this world, in this country, in
Yeah,
myself, for that matter. Saying
right.
bye bye to high blood sugar. Bye bye. Go
Yeah,
away. I do not want you. It's funny. My mother told me about high blood pressure when I was
right.
diagnosed with it, and I don't have that anymore. But she said, "Well, yeah, that's hereditary. You just kind of have to live with it." I said, "No, I don't want it. I
Right.
really don't." But
Yeah.
there are ways, things that we can do in that regard. So thank you
Oh,
so much for being a part of what we're
absolutely.
doing here. I do have 3 final questions for you that I ask all of my guests. But before I do, I want to thank you for listening to and watching Tell Me Your Story, New Paradigms for a New World. We are
Thank you.
giving you choices and knowledge of those choices to help you make your dreams come true. Sundays at 7 a.m. and 7 p.m. Monday morning at 1 a.m., 9 a.m. on Wednesday, and Monday through Friday from 8 to 9 a.m., streaming live at those times at richarddugan.com. We are also podcasting on SoundCloud, iTunes, TuneIn Radio, Spotify, Stitcher, Player FM, Blueberry, iHeartRadio, Amazon Music. We're on
Wow.
YouTube, where you can watch these conversations. Please subscribe and then click notification. Also, go to Amazon to get a copy of my book, Choices, 5 Steps for Life. Choose Dr. Janette Gray. Maybe get in touch with her through her website. There's a choice for you. And it would be a good one. But get a copy of my book, Choices, 5 Steps for Life, at Amazon. And also, if you can leave us a tip, we have a tip jar. It's called PayPal. And on the homepage at richarddugan.com are 2 links, one to Amazon and one to PayPal. And thank you to those who have helped and to those who will. And finally, we ask that you take time during this decade of perfect vision, the 2020s, and we ask that you take the time to go within to that quiet, peaceful, calm, still place and listen to that still, small voice. With all that being said, we go to our final 3 questions. And the first of those 3 questions is, who is Janette Gray?
Mm. She's an individual that's on this earth trying to find purpose and wholeness.
What gets you up in the morning?
I love being able to make a difference in people's lives. And if I can have that kind of purpose, as long as I live, I feel joy.
And finally, what was your best day?
My best day was probably when I graduated from medical school. I felt like I had made it through the grind, but little did I know I had a lot of life ahead of me.
Yeah. Well, I didn't go through that grind. I just put the DR in front. Actually, it was given to me by some people here, and I'm grateful for that as well. But I will never practice medicine without a license. So don't worry. Thank you
Now, you
again
have
for joining.
plenty of wisdom, so
Thank you so much. Well, thank you again for joining us, and I
yes,
thank you folks for listening to and watching Tell Me Your
thank you.
Story. And until our next broadcast, podcast, videocast, love to all. Janette, I'm still listening. Dad, continue to be happy because I am. Smokey, I will see you on the other side.
All
Mike,
right.
thanks for being in my life and letting me be in yours. And to my dear friend Zorro, aho, aho.